It's Anonymous MD with Dr. T.
And Lisa.
Dr. T brings the real and refreshing insights, straightforward, evidence-based, and up-to-date. Now here's the doctor and Lisa.
Hey, here we go. What is that? Episode 9, Lise. Welcome back.
That's right. Number 9. Thank you.
Crazy.
Nice to hear you again.
Yeah, the journey continues, and we have a really, really good episode today with a doctor from the Mayo Clinic down in Jacksonville, Dr. Dacre Knight. Pumped.
So exciting.
So exciting. And he's also served in the military too. So we're going to get into that a little bit as well. And I know they have, COVID clinic down there that they're running, and they have some other tests running that we talked about on previous episodes. So what do you say? You want to jump into some numbers?
Let's jump into it so we can get to our guest and stop wasting time here, Dr. T. Come on.
I agree. Okay. So as of today, about 292,000 reported deaths around the world, and just over 4.3 million reported cases around the world. And we always like to say, throw those numbers out the window, because we can't calculate that case mortality rate. We don't know those numbers. They're just inaccurate. But we do want to compare two numbers that are more well established. And today we decided to choose suicide.
That's right. Not the most cheerful of topics, but an important number.
Yeah, especially when we talk about mental health. So 1 million worldwide die by suicide. So
on an annual basis.
On an annual basis. So if the reported deaths are in fact, as we suspect, to be higher than 292,000, then, we're starting to see the effect of this pandemic. So without further ado, shall we?
Let's get into it.
Okay, so we have Dr. Dacre Knight, and he's an internal medicine doctor at the Mayo Clinic in Florida, and he's a senior associate and consultant. He completed his residency at the University of Mississippi at the Medical Center, and then served 4 years in the U.S. Air Force as an internist. He was in Afghanistan, and he covered the ICU and inpatient ward for a combat trauma hospital. He joined the Mayo Clinic in August 2019. He is now establishing a pilot clinic for Ehlers-Danlos syndrome. Please look that up, folks, Ehlers-Danlos syndrome, and learn about it. And he's been doing that since November 2019. But he's got a lot to offer when it comes to COVID-19, because they have a state-of-the-art COVID clinic down there in Florida, down at the Mayo Clinic. Dacre, welcome.
Hey, thanks a lot. Great to be here.
No, I'm really, really happy to have you here.
Thanks so much for taking the time to be with us. We so appreciate it. You sound a little bit like a busy person, so thank you.
Well, you
much.
look like one too, so get the mask
been
on.
Busy. That's right.
Get the mask on.
It's been a pleasure to be here, so thank you.
Yeah, so Dr. Knight's just wrapping up a shift down there, and he's taking a bit of time before he heads home. So let's start with this. Dr. Knight, tell us, are there any organizations, philanthropic causes out there you want to present to our listeners today on our platform?
So yeah, just as you mentioned, we had been running an Ehlers-Danlos pilot clinic here, and then things took a totally change of pace with this pandemic. So we had been working with the Ehlers-Danlos Society, and all the way up and through February, March, we'd actually had planned to attend their conference and present this coming July, but now it's that, among with all the other travel plans we had been canceled. So that's one, but also going back for further military service and fellow veterans, I have recommended the Wounded Warrior Project and worked with them when I was stationed at Scott Air Force Base just outside of St. Louis. Also, the Mayo Clinic obviously does some wonderful nonprofit work and has lots of ways to give through them. Right now, though, more recently, we have been coordinating through the Red Cross with a plasma donation for the COVID-19 convalescent plasma. So we have been enrolling patients for that. So definitely something that's very important going on with the current scope of things.
Can you tell us a little bit about what you mean by convalescent plasma when it comes to COVID-19?
Yeah, certainly. That's a great question. So, this is the plasma, this is the blood product from the patients who have had the infection. So, have had a confirmed infection for coronavirus and have recovered. So, they have had negative testing, positive testing first to show that they had the disease, then negative testing to show that they have recovered. And then, as a confirmation, they have serology tests to show that they have antibodies present to this virus. So the idea is that they will take this portion of their blood, the plasma that contains the antibodies, they'll give it to those who have severe complications of active infection, and they will give that donation to that patient. And there has been some good signs that this is having a positive effect on those patients.
So
That,
Dacre, is that what we call IVIG therapy? Just for our doctor listeners out there, or is it a little bit different?
it's a little bit different. So yeah, IVIGs, you're getting the immunoglobulins for some immunodeficiencies and diseases that come with that. This is this is an active antibody for this specific virus. We don't know exactly what the precise amount of antibody you need for it to be effective, and we do match the blood types for the patients who are suffering from coronavirus. But this is a very unique scenario. It's been done before as a type of a treatment, but this is unique to
Yeah,
coronavirus in
because
this
this
case.
sounds like something like pretty new to me, something that I haven't really heard of being done before. Like, do you have an example of where we've used it before in medicine?
Yeah, so it has been used in the past. I mean, the way the vaccines have developed through history have come in all shapes and sizes, right? So at one point they tried using sheep's blood for various illnesses, and and through the years they've actually found that in some patients who have active infection or have recovered from infection can actually help patients who are continuing to suffer from this infection. So what this situation has presented is a pretty dire case where we are limited in treatments. We have no vaccine available at this point. So what can we possibly use? And we're just pulling out the toolbox to use
Right,
absolutely every resource we possibly
right.
can. So
in other words, the people who are convalescing are almost like little vaccine incubators themselves. And they've created already that reaction, and so we're skipping a step. Although, I mean, I'm sure it's not quite as scalable as vaccine generation, but it's what we can do right now. So that's really amazing to hear. And I'm guessing that we don't use the sheep's blood anymore, so I shouldn't go out and buy sheep's blood. No.
no, no, the
No,
convalescent plasma will be a better bet. But you do bring up
Okay.
a good
Thank
point.
you.
It is hard to scale because it
Mhm.
relies on one person to donate, and we have obviously some patients recovered, but not everyone can be a donor either. Some patients with immunodeficiency or other types of diseases, we don't want to spread further illness, so we have to screen all those patients who can be donors. So that does limit the supply as well.
and another question that comes to my mind is, at what point in the disease process do you use it? So, how bad is the prognosis at which time you would employ something this new? So I wonder how those kind of guidelines are being established, but this is just changing so quickly. It's the first time we've talked about this type of therapy on our podcast. So again, we thank you for joining us, but we have more questions. We have so many more questions. We're going to try and keep you here for a bit.
All right,
So
that's great.
you've already taught us so much, just like Dr. T said. But I'm wondering what's the main message you'd like to give our anonymous MD listeners?
So there's a lot of messages that people have been hearing from various sources, and I understand that it makes it very difficult to sift through it all. It's almost an overload of information, and I feel guilty in part because here I am talking about overload of information and providing more information, right? So it's a little bit ironic, but what I would say to that is that it's a matter of what the sources are of your information, and access to reliable sources is so important right now. This situation is just ripe for conspiracies, right? I mean, everyone's at home,
Absolutely.
and
Yep. And
it's the
especially
first
with
time we've
social
encountered this,
media, and
right?
it just spreads like wildfire.
Exactly. So that's the main message. Just make sure your sources are verified and reliable. I know Dr. T is promoting evidence-based medicine, and you couldn't go wrong with that. So
Yeah, and when we talk about this is a really quick side off. Evidence-based medicine. This is a term that came out in the late '80s, early '90s, and it's a triad. And it's a triad that includes research, clinician experience, and patient preference. Okay, so if you don't have the research, your evidence-based medicine is literally left to the duo of patient preference and clinician experience. And that's really what we have with COVID-19. So our listeners have to remember that. And when we talk about sources, even reliable sources of information, the data that's coming out are still just preliminary investigations, what we call case studies or case reports. So we can't draw any conclusions, but they'll help guide future studies. So I think I think I'm just trying to follow your message here, Dr. Knight, and say, well, let's get our information from reliable sources like the Mayo Clinic, who are institutions that don't come and draw those conclusions that we see in the popular media and in the social media, because they try to adhere to that evidence-based triad.
That's exactly right. Yeah, the Mayo Clinic is a great resource, and CDC, all of those. But what's important is to also understand that if you feel like you're getting an overload of information, there's anytime you can take a step back and just try to limit yourself from the exposure of news and media and things like that if this is causing an effect on your mental health. I know that you all focused on this in previous podcasts, and that's a very important topic as well.
Absolutely.
Thank
It's
you.
such an
Thank you so
important
much. Yeah.
topic.
Yeah,
A good way to do that, if you want to still stay informed but stay balanced, is just to watch one trusted news source at, once at 11 p.m. or at 6 p.m. or whatever your preferred news time is, and go about your day the rest of the time. It's a good way to do
we
it.
can't get overcome by this. And thank you for alluding to our mental health mini series there, Dr. Knight. Those are episodes 5 and 6 for our listeners. And so you've been running a COVID clinic down there now, yeah, you mentioned that that's kind of shifted focus. All of our focus has really shifted towards this for good reason. So tell us, what are you learning from running the COVID clinic? What kind of tests are you guys running? We've gone over antigen versus antibody testing and swab testing versus blood testing. So maybe you could give us some info, because as of now here, where we're podcasting in Canada, we do not yet have access to serology testing.
Yeah, sure. I would be glad to explain a little bit what we've been doing. And we've been learning a lot. So we've been learning so much as it goes on, just like every other researcher out there. And it's just fascinating to see how much we're learning, how fast, and how it changes our practice so quickly. So what we had started out at the first stages of this pandemic, so we had our first cases in March, and we were realizing that we had to have a home for these patients. Where are they going to go? Who is going to monitor them? Is the primary care going to be overloaded with these patients? And the hospital will be equipped to manage them all or not. We don't know. So we set up, we redeployed some of our providers in internal medicine and family medicine and pulmonology to help set up this coronavirus virtual clinic. So we were the ones that were going to be monitoring all the patients that were not in the hospital. So these patients had come into the emergency room or through a drive-through testing site we had set up on campus. And for every positive result, we were notified of these. We called the patients and gave them a rundown of what the most common questions were. The first one being, what do you do now that you've tested positive? So we run through the guidelines for isolation, the other issues about limiting exposure and monitoring symptoms, what you do if symptoms are worsening, and so on and so forth. And then we set up an arrangement where we would monitor them by telemedicine at least every 2 days, maybe more often if they had worse symptoms.
Great.
And then we would come up with a plan of determining when they would be completed as far as isolation goes. And then when that was finished, we would give them our information that they could call and reach back to us if they needed any more questions. But ultimately, we would discharge them from our clinic, and we had, I guess, well over 100 patients, but all had made fairly good recovery. So it was good to see. Some of them are
Any
still active.
mortalities that you guys had to face?
No, we did have quite a few patients who were going into the hospital, and they are all discharged and managed to convalesce with success. So that was a good result.
Good. And so have you guys now been able to test the blood of some of these patients and see if they've developed antibodies to the virus?
Right. So that's one of the testing strategies. The other one is the PCR. So we initiate the PCR. That's the nasopharyngeal swab. So
Right.
that was through the drive through the emergency room, and so that would detected presence of the RNA of the virus, and if they were suspected to be with the acute infection. So we also employed the serology testing at the end, which is the antibody testing you're talking about, the blood test, to determine one, if they were going to be viable donors for the convalescent plasma, which I mentioned, but also if they meet other criteria for serology testing, which currently we have right now is based on 4 characteristics. So those are: one, that they've had a concern for exposure; two, they have active symptoms of coronavirus; three, they have tested negative by PCR. And then the fourth one was that they were um, still having symptoms, or did I say that? So they had active symptoms, prior exposure, tested negative, and um, it would change their course of therapy if they were to test positive. So if they tested positive with serology and still had active symptoms, then we would consider them to have an active infection.
Got it. And what if they tested negative and still had active symptoms?
So if they tested negative for serology and negative for PCR, then we would
Mhm.
consider them to have had an alternate infection, maybe
Right.
community-acquired pneumonia or maybe some other viral
Or it's
pneumonia.
also, like we know that there's some post-viral nasal pharyngitis, post-viral ear, nose, throat inflammation that can linger as well. Um, so, and one of the complications we have up here in Canada is that we actually go through the 4 seasons. So we're going through this pandemic as we go through our seasonal allergy season. So making those distinctions can actually be a little bit challenging for us up here as well. Um, so very interesting stuff.
So we've learned a little bit about what you're doing now, but we know that in your past, you've
Oh, this is the good
courageously
stuff.
served in the military for, I think, 4 years in the Air
Thank you
Force.
for your service.
Yes, thank you
That's
very
right.
much. I know we are not in the same country, but we
Yes.
are allies for
You
life. And
fight for
so
our
your
freedom
fight
too.
is our fight as well. So we appreciate
Yes.
it so much.
Well, thank
Um,
you.
yeah. And
And thank you.
so what do we think? What's your message for military listeners? That's something we haven't touched on at all yet on our podcast. And I think you're the perfect person to give them a message.
Yeah, the military population is a unique population, almost similar in some ways to university students or anyone else living in those close confined dormitories or barracks. And when I was deployed to Afghanistan, we were living in essentially it was a barracks, but for all intents and purposes, they were quite similar to my freshman college dormitory. So you had 4 guys to a room, bunk beds, all the rest. So what does that do for a pandemic? Well, obviously it increases your exposure and risk from spread just so dramatically. So in any case, even outside of the pandemic, these military members are having quite thorough vaccination schedules. So for bacterial meningitis and things like that, which a common person may not have to have if they're just living at home by themselves. So we've seen an example of that with the aircraft carrier, the USS Theodore Roosevelt, had over I
That's
think
right.
1,000 sailors that had now tested positive, and that's just a prime example of the outbreaks that can happen within the military.
Yeah, we know that, we are pretty certain that this is droplet and contact precautions, and we've gotten over those definitions on previous podcasts, but it does seem to have a tendency to spread quite easily once you're within those close quarters. Um, I just want to add one thing to our listeners. We think about our military as combat risk or combat injuries, but we really don't think about how they live in close quarters like that, and that puts them at higher risk of contracting certain conditions. And that's over and above them spending Christmases and Easters and Thanksgivings away from their families. So we can't forget what our soldiers do for us. And we're so honored to have someone who served in the U.S. Air Force and who is on the field here on the show today. It's just I'm getting goosebumps, just
too.
out of just the gratitude I have towards you, Dr. Knight. We covered a lot, and like you said, we don't want to do information overload, but I think we've done a pretty good job of adding more kind of dynamics to the picture, even though we don't have answers. But if there were any like last messages you wanted, and here's the other thing is, definitely if you guys start getting some data and finding out some answers, we're happy to have you back anytime to update us. But any final messages for our listeners out there?
Yeah, I know we're all going through a very difficult time. I mean, everyone, from the moms at home homeschooling up to the ICU doctors who are really getting a lot of exposure to the emergency room, all the rest. I feel actually myself kind of fortunate to be helping out in a way, but also at a distance through this virtual clinic. But there's so many that have provided so much, and there's not enough gratitude to go around for all of those that have provided all of the research, all of the kind of the guidance on supporting the mental health, on just understanding how we can all cope with this. And I think actually one of the best examples I saw of that, it was the speech, which I think a lot of people have already seen on YouTube, of Queen Elizabeth kind of giving her folks this push to hold faith and persevere, even though it was all directed to those in England. I feel like just being a member of the human population at this point, we've all
was that her 75th anniversary speech of World War II? I saw that a couple nights ago. Or was it a COVID-19 speech? Where could we find that?
Yeah, it's the one like Lisa was saying, just for the COVID speech.
Yeah, that okay.
Mm-hmm.
Okay.
Really inspiring though, and it's great.
It was, and she broke protocol. Actually, she doesn't usually do speeches for world events like that. So she broke protocol because she knew it was necessary. And her message has always been through World War II: keep calm and carry on. And so, sort of the same message repackaged for us today.
Yeah. So I did see that, and Dacre, that's a video that I think everybody should watch. There was something just that inspired you from the Queen. She's been such a big figure in our lives growing up since we were little kids. And so
yeah, we've had our differences with them going back a couple hundred years, but
of course, so we
definitely feel inspired by what she's had to say about this.
Yeah.
Though.
I mean, you don't carry her face around in your wallet like we
that's
do.
Right.
Yeah, that's exactly right. Yeah, we're a bit more under the monarchy. Yeah, so.
Okay, so wonderful. I think that we've covered a lot today, and I think we've done it in a really nice and pithy way so as not to overwhelm everyone with too much information. But I think we've talked about the fact that, what's touching me the most actually is that the military that are men and women in service are putting themselves at risk in a way that they hadn't anticipated.
Right.
And so that their bravery extends beyond what we thought possible. And so that, perhaps we should be thinking about them a little bit more than we have been. And that serology testing is the way forward, it seems, and that the Mayo Clinic is really leading the way here in doing that. And that a virtual COVID clinic can make all the difference to patients who are being monitored from a distance, but feel that care coming through the air, through the Wi-Fi, through the phone lines, and are prevented from having adverse reactions as much as possible.
Great episode. To our listeners out there, remember, wash your hands, keep your distance, don't touch your face, wear your mask for others. Thanks to Mike at the Pod Plant, our great producer, Lise, the brilliant host of the show that I co-host, or whatever you want to call it. And we've been so privileged to have Dr. Dacre Knight with us here today. Thank you so much.
Thank you so much, Dr. Knight.
My
it's
pleasure.
Been a true pleasure.
Yeah. We hope
Thank
to have you back
you
again.
back.
Thank you.
Absolutely.
Bye
Thank
now.
you all.
Bye now. Take care, everybody.
Thanks for listening to the show. Subscribe wherever you're listening to the podcast. On YouTube, smash that bell. That's a notification button. Anytime the doctor knows something, so will you. Stay healthy. See you next time.